Federal cuts to healthcare programs like Medicaid are squeezing rural healthcare systems, and that's putting pressure on the relationship between hospital ownership and their employees. In Plattsburgh, nurses aren't ready to strike yet, but as talks continue for a new contract, they're telling the public what they need. A visit to an informational picket on today's story of the day.
Support for Story of the Day comes from Morja Wealth Management, serving the North Country for 3 generations. MorjaWM.com. Advisory services offered through Hightower Advisors LLC. Securities are offered through Hightower Securities LLC, member FINRA, SIPC. And Kinney Drugs, now accepting S3 Nations benefits and OTC Network Wellness benefit cards for eligible over-the-counter health items. Details at KinneyDrugs.com.
Hey, I'm David Sommerstein. It's Tuesday, May 26th. Hope you had a great Memorial Day weekend. First up, if you're not already registered to vote, there's still time ahead of the June primaries. North Country residents have until June 13th to get their applications in by mail or register in person at their local board of elections. It's too late for voters who are already registered to change their party affiliations. The deadline for that was February 14th. The biggest races in the North Country this year are the primaries in New York's 21st Congressional District. St. Lawrence County farmer Blake Gendebine and Lake Placid businessman Stuart Amaral are vying for the Democratic nomination. Assemblyman Robert Smullen and Sticker Mule CEO Anthony Constantino will face off for the Republican line. We have more information on important voting deadlines on our website, ncpr.org. The primaries are on June 23rd. Canadian travel to the U.S. is down for the 15th straight month, the result of President Trump's tariffs and trade war with Canada. Government officials are asking Canadians to travel domestically instead of visiting the U.S. this summer. The cross-border tensions are affecting the tourism and alcohol industries in the U.S. Dan Karpinchuk reports for the New York Public News Network.
Ordinary Canadians have been fighting back in the ways they can, choosing to vacation at home and choosing not to buy American products, especially booze. And after a year of it, Washington is taking notice. It's become so bad that Trade Secretary Howard Lutnick calls it a trade irritant.
It is outrageous that Canada will not put U.S. spirits on the shelf. It is insulting.
And the head of the Distilled Spirits Council of the United States says the numbers are not good, especially when the industry, at the end of 2024, was poised to show gains. Chris Swanger says distilleries in the U.S. have lost about 1,000 jobs after exports to Canada fell by more than 60%.
We've seen a reduction in jobs, and small craft distilleries in the United States are feeling that pressure. Some of them are starting to shut down.
And Canadians aren't looking to return to the status quo anytime soon.
I just stick to what's available and what's delicious. Mostly Niagara Falls. Super happy to support Canada.
I don't go there. I have family there. Haven't visited in a hot second.
I won't spend any of my extra money on anything from the United States.
It gives us leverage. We can't give that up.
The latest surveys support those sentiments. A recent Nanos survey shows that 8 out of 10 Canadians feel the boycott is helping Canada. 53% say the boycott is helpful, 29% somewhat helpful. Nick Nanos of Nanos Research says that rhetoric hasn't changed in months.
I think a lot of this has to do with the fact that there hasn't really been significant progress in the trade discussions with the United States.
And new data shows that the travel boycott by Canadians could be even more dramatic than at first believed. Statistics Canada reports a 25% drop in trips from last year, but a study by the University of Toronto using cell phone data suggested the drop in cross-border trips was more than 40%. Karen Chappell was the lead researcher and director of the university's School of Cities. She says the cell phone data is a measure of Canadian activity in the U.S.
So far, all we had seen from CBSA data was border crossings. But what we can do is look at what happens when Canadians go over the border and how many cities are they visiting? Are they maybe visiting fewer cities before, which is what we found? And are Canadians that were in the U.S., maybe for work, maybe for school, are they coming home? And that we've lost some Canadian cell phone pings throughout U.S. metros, we think in part because the Canadians there have left. So it's not just about the ones in Canada making fewer trips. It's about folks coming home.
A return to pre-2025 numbers isn't likely to happen until there is progress in trade talks. That includes a new North American free trade agreement and less talk from Washington about a 51st state. I'm Dan Karpinchuk in Toronto.
The union that represents almost 900 employees at the hospital in Plattsburgh is negotiating a new contract. Members picketed outside Champlain Valley Physicians Hospital last week to push for safer staffing ratios and limits on the use of artificial intelligence. Kara Chapman was there and has our story.
Hey, hey, ho, ho, understaffing's got to go, hey, hey.
Nurses and other healthcare professionals chant and wave hand clappers as they march up and down the sidewalk outside Champlain Valley Physicians Hospital. They hold signs that read, "Listen to your nurses," and "Safe staffing saves lives."
No contract, no peace. No contract, no peace.
These workers are part of the New York State Nurses Association union, known as NYSNA. NYSNA's contract with CVPH expired in December. There have been more than a dozen negotiating sessions on a new one so far. A big sticking point has to do with nurse-to-patient staffing ratios.
Last year, management unilaterally raised our safe staffing ratios.
That's Shawn Baker. She's a nurse on the medical surgical unit and chair of the hospital's staffing committee. Baker says CVPH increased the number of patients per nurse on her unit from 4 to 5.
We said no. They did not listen. Now we are getting ready to update the staffing plans, and NYSNA nurses are worried that the hospital administrators are going to make our safe staffing ratios even worse, which is even less safe.
Longtime CVPH nurse Chris Swise says higher ratios also hurt nurse retention. He works in the ER, where the ratio is sometimes 8 to 10 patients per nurse.
We spend the time and the money to train people, and then they cannot take it anymore, and they are gone. You are left with a fresh group of nurses with nobody to train and mentor them.
NYSNA members want staffing ratios enshrined in the new contract. The union's also fighting to maintain members' benefits. Calls for safe staffing levels and good health insurance have been part of these contract negotiations for years. A newer issue is the use of artificial intelligence in healthcare. Vicki Davis-Corson is a registered nurse and NYSNA's Eastern Regional Director. She says the union doesn't want AI to end up replacing nurses at the bedside.
People need people. They need people who care. They need people who have compassion to help them through their difficult times in life.
There are other concerns around AI. A recent joint study by Harvard and Stanford found that even the leading AI models used in clinical settings made errors critical to patient care in up to 15% of cases. Most of those were errors through omission, where the AI didn't recommend follow-up care when warranted. Ransley Garrow, a desktop engineer with the CVPH IT department, says that's not good for nurses.
It puts an overworked nurse in the position where they now have to take care of their patients while also double-checking anything that an AI model does to ensure that it's not making any mistakes. A tired nurse, an overworked nurse, is not going to as easily catch these mistakes.
So, union officials want limits on the use of AI in the contract as well. In a statement, CVPH President Michelle LeBeau said the hospital is negotiating with the best interests of its employees, patients, and the community in mind. She said mounting regional, state, and federal pressures in today's healthcare environment are making a challenging process even more difficult. LeBeau said those pressures also make it, quote, more important than ever to ensure our patients and community continue to have access to the care they need. Davis-Corson says she's hopeful, but not confident that hospital leadership will bring something the union will accept to the next negotiating session. She says a strike is possible.
We are not quite at that point yet, but we are working toward that. I would say yes.
CVPH and NYSNA are due back at the negotiating table on June 10th. Union nurses at Adirondack Medical Center in Saranac Lake and Alice Hyde Medical Center in Malone are also working toward new contracts. So far this year, NYSNA members have settled contracts with the hospitals in Watertown, Carthage, Ogdensburg, and Elizabethtown. Kara Chapman, North Country Public Radio, Plattsburgh.
We have more news all the time on our website, ncpr.org. Music today by Zoe Knight of Potsdam and Tim Ellifritz of Johnsburg. I'm David Summerstein, North Country Public Radio.